Welcome to Safe Step, the channel that is all about high-risk health moments that people don't realize are dangerous until after something goes wrong. Everything that we talk about here is grounded in clinical research, geriatric medicine, and public health guidance, explained in a way that families can actually use. This video is for educational purposes only and does not replace medical advice. Never stop or change of medication without speaking with a qualified healthcare professional. When someone falls, families will usually blame the floor or the shoes, their balance, the age, but one of the more common causes of falls doesn't look like a hazard at all. It looks like a pill bottle. Medications are one of the leading modifiable risk factors for adults for falling for people over 50. Not because medicine is bad, but because certain drugs cause changes to how the brain or blood pressure, muscles, and reflexes work. And often people don't know that they're at risk until after the fall happens. Tonight, we're talking about the medications that quietly increase the fall risk, why they do it, and what families should watch out for. So why medications affect risk? To understand this, we need to understand how the body stays upright. Balance is not just a leg strength, it's a full body coordination process that involves the brain, the inner ear, blood pressure regulation, muscle strength, reaction, time, and vision, and nerve sensation to the feet. Many common medications can interfere with one or more of those systems. Some slow the brain, some lower blood pressure too much, some cause dizziness or blurred vision, and some affect coordination or alertness. One medication might have only one small effect, but multiple medications together can have a stacking effect where side effects overlap and increase fall risk significantly. This is known clinically as polypharmacy risk, and it's a major focus in geriatric medicine. Medicines that affect the brain. So let's start with medications that affect alertness and reaction time. These include sleep medications, anti-anxiety, sedatives, some antidepressants, and some pain medications, especially opioids. These drugs can cause things like drowsiness and slower reaction time, impaired judgment, confusion, poor coordination, and clinically, this is called central nervous system depression. The brain processes balance and spatial awareness much more slowly, which means a person may not correct themselves quickly enough when they do trip or lose their balance. These medications are strongly associated with risk fall and fracture risk, especially in older adults. And the effects is often the strongest at nighttime or when you first are starting off on the medication. When the dose is increased, or when combined with other things like alcohol or sedative drugs. Medications that lower blood pressure. Next are medications that affect blood pressure and circulation, which include blood pressure medications, diuretics or water pills, some heart medications, and some medications to prostate symptoms. These drugs can cause arthrosciatic hypotension. That means when someone stands up, their blood pressure drops too quickly. Symptoms may include lightheadedness, dizziness, blurry vision, feeling faint, sudden weakness. This is one of the more common medication-related causes of falls, especially in the morning, after meals, or during illness and dehydration. The person may not feel sick. They may just stand up and the room shifts. That moment is where many falls happen. Medications that affect balance and nerves. Some medications don't cause sleepiness or blood pressure drops, but they affect nerve signals or balance systems. That can include certain seizure medications, some antidepressants, medications for nerve pain, some chemotherapy agents. These can cause unsteady walking, numbness to the feet, tingling or reduced sensation, or poor coordination. When the feet cannot accurately sense the floor, balance becomes much more difficult, and the brain relies heavily on foot sensation to make tiny adjustments while walking. This type of fall risk is often gradual or mistaken for just aging. The risk increases with the number of medication. And here's something that many families don't realize. It's not just what medications someone takes, it's how many. Research shows that fall risk rises significantly when someone takes multiple medications that affect the brain or blood pressure. Even medications that are appropriate and prescribed correctly can interact in ways that others increase dizziness and sedation and weakness. This is why medication review is a key part of fall prevention in clinical practice. Warning signs medications may be contributing. Here are signs that medications may be affecting balance or safety. You have new dizziness or when starting or changing a medication. Increased sleepiness throughout the day. Confusion that wasn't there before. You're feeling foggy or kind of slowed down. Maybe you're unsteady walking. You need to hold on to furniture or whatever you can grab a hold of. Falls that happen soon after standing. Falls that happen at night or on the way to the bathroom. These are not normal aging. These are signals that something in the system may need adjustment. So what should families do? Do not stop taking medications suddenly unless a medical professional tells you to. Some drugs may be tapered safely instead. Schedule a medication review with a doctor or pharmacist. You need to bring a full list of prescriptions, over-the-counter medications, vitamins, sleeping aids, herbal products, and specifically ask, could any of these increase fall risk? Are any doses higher than needed now? Are there any safe alternatives? Should timing of doses be adjusted? Medication adjustments can significantly reduce fall risk without sacrificing necessary treatment. Then there's the emotional side. Here's the part that families really don't talk enough about. People often feel embarrassed when medications make them feel unsteady. They don't want to seem fragile, or they don't want to feel like a burden, so they choose to say nothing. But silence leads to falls. Speaking up about dizziness or unsteadiness is not complaining, it's protecting your independence. Safe step message. A fail is not always a sign of weakness. Sometimes it's about chemistry, if the balance has changed or alertness has changed, if confidence or walking has changed. Medications may be part of the picture, and that is something that can often be improved. Falls don't usually come from one particular cause. They come from small risks stacking up. Medications can be one of those hidden layers that is often overlooked. In our next Safe Steps video, we will go and look at something that's just as important, which is how to set up the home environment to reduce the fall risk and support safe aging in place, because safety doesn't stop with the body. It includes the space around it. Take care and take the next step.